Hello everyone, it's Dr. Mike, and thank you for taking the time to watch this video. Now, you're here because you want to get a better understanding of what we mean by this term referral ready and also reimbursement ready. Well, now, we've been teaching the medical exercise specialist since 1994. And folks, back then, it was a simple handoff. Patient came in for physical therapy. Physical therapy was concluded. We then transitioned the patient into a client that was going to work with a medical exercise professional in a fitness setting, or maybe even in their home. Well, folks, the healthcare system has changed significantly since 1994. And now more and more clients are asking you, hey, can maybe you give me a copy of what we're doing here, some type of bill, some type of documentation so I can deal with my insurance carrier. But also we're finding more and more medical professionals are referring clients to you, which means you now need to be able to accept those referrals. So the idea of being referral ready means that you have a system for accepting referrals from the medical professionals, bringing those clients in a timely manner, also obtaining a written referral from the medical professional that particularly says either medical exercise training or functional conditioning services or what they're requesting. It should not say anything about physical therapy. And with that, you have an intake process that you have in place. With that intake process, you now bring this client into your practice in a timely, professional, procedural manner. And what I mean by that, there's a step-by-step process. And it's not just happenstance or it changes from client to client. That means now you've put systems in place. So referral ready means bringing the client in. Reimbursement ready, though, now means you have the ability to provide that client with documentation that shows what you did in each session, what services you provided, how much you charged that client, how much they paid, and the client is now able to give that to their insurance carrier. Folks, now, when we started the medical exercise specialist back in 94, it wasn't difficult to find clients that had the revenue or the money to pay for medical exercise training services. Well, folks, the economy has significantly changed. And since the changes in the economy now are becoming more significant, you may have to help your clients a little bit by saying, you know what, I can provide the necessary documentation to you. So now you can send these charges on to the insurance carrier. They can see what I did from the documentation, including my session logs and progress reports, which I've shared with the medical provider, as well as giving you a bill that shows specifically what was done during the session using CPT codes. Now, let me make sure you understand you're not providing any aspect of treatment. You're not providing any therapy. You're simply using the CPT codes to indicate to the insurance carrier that the client is going to communicate with that you're providing these medical exercise or functional conditioning services. And it's vitally important that you do get a written referral from the physician. So that gives you an idea of referral ready and reimbursement ready. But let's talk about this referral and reimbursement ready checklist. We put this checklist together because I know a lot of you say, well, yeah, my practice is ready. I can take referrals. I can deal with insurance reimbursement and helping my clients get it. But we want to walk you step by step through the process that's necessary and ask you to go through this process to see if your practice truly is referral ready as well as reimbursement ready. So we're going to go through the referral ready checklist first. If you're on our website, you'll see down below that you can actually review this step by step as we go through. I think down at the bottom of the page, you should be able to actually download a copy of this. And if you have any questions with this, please email me at drmike@postrehab.com, but also tell me how well you do. Now, the way we're going to do this is if you aren't or do not or are not able to provide the service, you don't check the box. If you can fully provide the services or the concepts that we've noted in this with each item, then you check the box. So it's either a yes or a no. There's kind of no in between. And please be objective and honest about this along the way because it will help you manage your practice. So with the referral ready checklist, number 1, A, medical referral requirements. Now, I'm going to go through this list that I have here. You should be able to look at the list on our website down below or download a copy. With the medical referral requirements, these are non-negotiable. These are must. You cannot deviate from this. The practice requires a written referral from a licensed medical provider, particularly a physician, and that physician should be either an MD or a DO or a doctor of chiropractic or a naturopathic doctor. The referral specifies medical exercise training or functional conditioning. The referral includes a medical diagnosis, and the referral includes an ICD-10 code. The referral confirms discharge or transition from formal medical treatment. So at this point, the client is no longer a patient, they're now your client. Okay? Next item here, a referral intake system or systems. This is item number B. Standardized referral intake forms exist, or an intake form exists. There's a diagnosis and ICD-10 code that are documented in the client's record. The functional limitations are identified relative to the client's diagnosis. The scope of practice is clearly defined and documented, so you've told the client exactly what services you provide, your role, and where you fit in the process. And the client is transitioned again from patient, providing they're receiving medical care, to client exercise services. So they're clear on that. So that's item number B, or letter B. Next on our list, the assessment and programming alignment. Now this becomes important. The assessment is framed around functional capacity, not fitness goals. Exercise selection aligns with the diagnosed conditions and the limitations that you are able to determine the client's had during your assessment. The progressions are defensible and documented in that you don't have any wild reason why you're doing a certain exercise just because you like it or you did it with someone else. But the exercise program you've put together is defensible from the standpoint of it's based on evidence-based information you have, and it's also documented so someone else can clearly understand what was done. And the language you use avoids any types of diagnosis or treatment or therapy terminology other than just simply noting the exercises that were done and the client's specific diagnosis. So that's item C. Item D, provider communication systems. Now, again, this is still in our referral-ready checklist, which is part of our referral reimbursement-ready checklist. So item D, provider communication systems. This is important. There's an initial intake summary prepared for the referring provider. Progress reports are scheduled at defined intervals. In that you're not doing this happenstance. You have specified periods of times or intervals that you're sending out progress reports that are being sent to the client's referral source or their provider. Documentation uses medical appropriate and functional language. And with that, the communication is consistent, professional, and expected. Basically, what we're saying here, folks, is that your communication isn't that of a personal trainer just noting what exercises they've done, but that the communication is professional and is looking at it from the standpoint of, I'm a medical exercise professional. Here's what I've done with your client based on their diagnosis and their limitations. Here are the activities and exercises we've done for your review. And we're also noting the client's progress. All right. So with this, you want the physicians not to wonder what you're doing, and you want to make sure they understand how you fit into the continuum of care. Folks, for the medical providers, everything in medicine has a documentation trail, whether it's digital or written. You've got to get in now into the mindset of, I have to provide this doctor, therapist, or chiropractor with a report of what I've done with their client in the form of documentation, utilizing session logs or progress reports. And folks, quite honestly, they're not going to really get it when you just contact them and say, hey, the client is doing better. They need something written. And please remember this, in the healthcare system, everything has a paper trail, either a digital paper trail or a hard copy paper trail. So that is the referral-ready checklist. Now, we got another checklist here for you. That's our reimbursement-ready checklist. Again, this one is not you necessarily dealing with the insurance carriers directly, but providing the client with the necessary documentation, forms, and other items they need so they can deal with the insurance carrier themselves. So the first item here is reimbursement clarity. Okay. And this is to make sure you're protecting your scope of practice, but to make sure the client clearly understands that the client does not, or the practice, does not bill insurance carriers. Now you can, and we talk about that in our Cracking the Code manual, but in this scenario, we're talking about the idea you're providing all the necessary documentation to the client pays you, they're now going to try to get reimbursed for the services you provided and they paid for to you, by the insurance carrier. Clients are clearly informed that they are responsible for the submission of the documentation to the insurance carrier themselves, and there's no guarantee of reimbursement. Make sure they're clear on that, and also understanding your role as a medical exercise professional, that you've clearly explained that to them. So that's reimbursement clarity. That is a non-negotiable also. Item number B, documentation standards. Now, these are the standards your documentation must meet. Number one, it must, with each session, you must date it. It has a date. It must look at the duration of the services that were provided, the service descriptions, including the exercises or the activities, as well as the functional focus of that session, which is tied to the client's diagnosis. Folks, everything is about the idea of managing this client and managing them from the standpoint as that you're managing them based on their diagnosis that has been given to them by the physician. Okay. Next item, number C, client-ready reimbursement packet. Now, the session summaries are prepared so that the client can understand them as well as the medical provider can understand them. For the most part, the session law is only going to be kept by you or shared with the client. They normally don't go to the provider. They may go to or be given to the client so they can now share them with the insurance carrier. The progress reports are available upon request. So if the client asks for a progress report, you certainly give them to them. But the progress reports are being forwarded to the client's medical provider on a regular basis. That may be once every 30 days or whenever the client goes back for a follow-up visit. There's a clear service description provided for insurance submission so that the insurance carrier clearly understands who you are, your scope, as well as the services you provide. And the documentation is consistent, legible, and most importantly, it is professionally done. All right. So that's the client-ready reimbursement packet. Make sure each item that you are looking at here, that it is a yes, you check the box. If it's not 100%, then it's a no. Next item, D, professional confidence. Now, this is important. This is from your standpoint. The MedX Pro can clearly explain reimbursement support role. So your role is simply providing the documentation, well, obviously providing the services, providing the documentation to the client so they can deal with the insurance carrier. The MedX Pro can confidently answer the client's questions. You may not be able to answer specific questions about reinsurance reimbursement, but you can certainly answer questions about the exercise program that you provided, why you've developed the exercise program, the short-term and long-term goals, and any communication that you've had with their medical provider. There's no fear of overstepping your scope. You know exactly where you are, and you understand that you're staying in your lane within your scope of practice. And also, there's no avoidance of reimbursement conversations. You've been clear to the client. There's no guarantee that they're going to get paid. They are responsible for paying you when services are rendered, and you will provide them with the necessary paperwork. Again, that includes the written referral from the physician, which the client obtained in the beginning, or it was sent directly to you. You need to make sure the client has a copy. They can get that from you or from their physician. Along with that, the session guides, if they're necessary, to provide the insurance carriers, and most importantly, the progress reports. And when the client is done with medical exercise training services, if you've written any type of conclusion or discharge summary, that is provided so they can also give that to the insurance carrier. But you're always going to give them super bills that specifically outline what was done in the session as well as the charges for those sessions, and you're going to have to use CPT codes for those. Now, all of this results in clients that they trust you. The conversations are very calm and very clear, and your professionalism is unquestioned. Folks, clients don't want folks that, especially if they have medical conditions, they don't want the glitter and glamour and the great quads and the biceps. They want someone that's professional and is going to get them to the point or help them reach those functional goals that they need to go out and interact in their life and have the life they want after an injury or surgery or the onset of their condition. So lastly, we have a simple final self-assessment. Are you, or am I should say, referral ready? Am I reimbursement ready? My systems, not my personality, carry my practice. I think in the fitness industry, it's been personality, physiques, those types of things. Now it becomes your professionalism. And with that said, please, if you would, we're covering all of these items in our MES Enterprise cohort. If you did not 100% answer every question on this checklist or check it off in the affirmative that it's a yes, you might want to think about joining our MES Enterprise cohort. This cohort is designed to make your practice referral ready and reimbursement ready in 90 days. We start on February 28th. You look down below, you'll be able to get more information. There should be a link there where you can get signed up. We're only taking 6 participants for this program. I'm sorry, we're taking 8 participants for this program. And I know 2 slots are already gone, so we only have 6 slots left, forgive me. And this program is designed to make your practice referral ready and reimbursement ready. We have a number of master classes that you'll participate in. There's unlimited one-on-one coaching. Along with that, we also will have these master classes, as I said, that will go deep into every aspect of what you need to make your practice referral ready and reimbursement ready. And then the coaching sessions reinforce that when we work one-on-one with you to make it work in your particular setting. So with that said, again, we start on February 28th. Look down below, click the link, get registered. If you need to contact me to get more information, email me at drmike@postrehab.com. Sorry we took so long on this video, but please, if you would take the time, go through and complete the checklist. Again, if you have any questions, email me. But the checklist, if you're honest, it really will tell you, are you referral ready and reimbursement ready? Now, most important thing is, in 2026, the need for medical exercise training will continue to grow. It will grow exponentially over the next 20 years because of the baby boomers, the chronic health crisis we have, and the changes we're seeing in insurance reimbursement, which means you must be referral ready and reimbursement ready to take advantage of these opportunities. So thanks again. I look forward to seeing you on our MES Enterprise cohort. If you have any questions, email me at drmike@postrehab.com. All the best.